So if a patient comes in and they're complaining of sleep issues, there's some questions that you should ask them. The first questions that are great to ask if they've had any recent changes. I like to also ask them if this has been an ongoing problem for them, if they're getting up consistently at the same time every single time all throughout the week. I think that's extremely important. I think we don't put enough emphasis on how important it is to wake up at the exact same time every single day, even on the weekend. We should also ask if they're napping throughout the day. I think that makes a big difference. And then asking them whether or not they have problems falling asleep or staying asleep, or maybe a combination of both. If they have problems falling asleep, a lot of times it can be related to things like stress, anxiety, racing thoughts, if they're thinking about something a lot. Also, if they've been drinking a lot of caffeine, things like that, or if they've had any kind of stimulants, certain medications can keep them up as well. So if they've had a steroid recently, that can do it. Or if they started on something like Wellbutrin and they're taking it too late, that can also keep them up later. Also asking them about if their screen time, if they are getting on their phone, staying on their phone, doing any kind of busy work at least 1 to 2 hours before going to bed. A lot of people have problems falling asleep because of that. It just keeps their mind racing and busy. So in addition to that, asking them about if they're staying asleep, that could key us more into things like if they're not able to stay asleep throughout the night. It could be sleep apnea, it could be depression, it could be, I'm thinking here, it could be also physical problems, like if they've got urinary issues like acid reflux, or having pain. There are also some very specific things too, including things like temperature that can make a difference. So if it's too hot or too cold, those things can disrupt your sleep, so you may get up a lot. If your bed's not right, a lot of people don't realize how important it is to have nothing on your bed except for your comforters and things like that. So there's just little things like that, and sometimes background noise as well, lights. Some people like to sleep without lights, and some people like to sleep with them. So really trying to figure out what the sleep patterns are, and if anything's being disrupted. The thing that I think that I want to add on here that is an important one that I think people don't think about at all is eating too late. For myself particularly, if I eat after a certain period of time, I just feel worse. My face will get super puffy, my eyes will get puffy, I don't feel good. But if I stop eating at a certain time, like, my goal is to not eat after 5:30, but that doesn't always work, like, especially if I'm super busy or I get home late. But that is definitely something that I do notice, that I sleep better and I get up at a more consistent time, and I just feel better in the morning if I'm not eating late. Well, hope that helps, and if you have any questions, make sure to comment below.